I'm your host, Denise Van Vliet, author of the book, Embrace the Bitch Within, and BITCH is my acronym for Being in Total Connection with Herself. Now available on Amazon and Barnes & Nobles and Kindle. Today we're going to clarify some misconceptions about CranioSacral Therapy. And with me today, I have Lisa Gillespie. Welcome, Lisa.
Thank you, Denise. Pleasure to be here.
Oh, I'm so excited that you're with me today. Lisa has been practicing craniosacral therapy since 1995. Wow, Lisa, that is really awesome.
Thank you. Thank you. Yes, it's been a very enjoyable journey, and there's still so much more to learn, so it's exciting.
And in my book, I do talk about craniosacral therapy and a little bit of a synopsis of what it is. And Lisa, since you've been doing craniosacral therapy for so long, can you tell us what craniosacral therapy is?
Absolutely. I'd be happy to. Craniosacral therapy is a light touch, hands-on modality that helps to balance the structures that surround the brain and the spinal cord. So we work with the bones of the skull, we work with the tailbone, the sacrum. We also work with the sac, the membrane sac that surrounds the brain and the spinal cord, and we help to balance the flow of fluid, and we help to enhance communication within the nervous system so that the signals that it is sending out are nice and clear, and that there's good communication going on throughout the body.
I love that description about the communication between the brain and the nervous system and the spinal cord. And Lisa, I know we've talked a little bit, and tell us a little bit what craniosacral therapy is not.
Yes. Craniosacral therapy, I really think it's important to distinguish craniosacral from massage, because most people have a certain preconception when they hear the term massage of what is involved with a massage. And craniosacral therapy, if you're having the expectation of getting a massage, there's quite a bit of difference between the two. So with massage, you're manipulating the soft tissue, you're using different techniques such as friction, petrissage, getting into the muscles and the soft tissue, where with craniosacral, it's light touch, it is holding certain areas of the body for periods of time, and it is a much more subtle experience, or can be a more subtle experience, than massage. So I think it's really important to distinguish the differences between the two and to not call craniosacral therapy craniosacral massage. I think it's really important to educate our clients so that they have realistic expectations of what they're getting and can be informed to make a decision and a choice that is right for them.
Absolutely, and I always tell clients that they should wear comfortable clothing. So this is a treatment where they're not getting undressed.
Absolutely, yes. And that can be a really nice advantage for people. They may feel a little more comfortable. I've actually had people referred to me because their physician told them they needed to get a massage to help with their relaxation and tense muscles, but they were really uncomfortable with the getting undressed aspect and were relieved to know that craniosacral could provide them with similar benefits to massage, but they didn't have to withstand the discomfort of getting undressed and feeling more vulnerable with a stranger and someone they did not know.
Absolutely, and another huge advantage is I work with a counselor who refers women to me who have experienced domestic violence or sexual assault, and after experience that, the last thing you want to do is take off your clothes, but you can be completely dressed, and craniosacral therapy helps with that traumatic experience that is stored deep within our memory, within the spinal fluid and the cells. So with that said, Lisa, I know you've probably had a lot of experiences with some of your clients and some of the releases that have taken place. Can you share anything that we can use to kind of get an idea of what we can get from craniosacral therapy?
Yeah, absolutely. As you mentioned, the pairing of counseling with craniosacral can be such a powerful and valuable combination for people, because the counseling really helps them sort through the emotional process, and the craniosacral helps them get more grounded and in their body and feel more safe and more at home in their body, especially after a traumatic experience. So some of the clients that I have worked with have, as you mentioned, have experienced sexual abuse, have experienced different types of trauma, even something as perhaps what we may not consider to be as charged, but nonetheless was trauma to the body in the terms of surgery. The body has quite a lot to work with when it comes to surgery, and even though we may have come through it just fine and had a very positive outcome, it is a trauma to the body nonetheless to go through that process. I think one of my most meaningful experiences in terms of helping someone was an infant who had suffered severe brain damage as a result of shaken baby syndrome. And there was just tremendous amount of discomfort in her experience of life as a result of that. And the craniosacral therapy she had, even though she was nonverbal and unable to give words to her experience, the session had a lot of emotional release that occurred to it. She cried for a significant portion of the session. She thrashed. She, I think I even got bitten during that session, actually.
Oh, no.
Which sometimes is one of the dangers of the profession, but fortunately it happens rarely.
So you got bit because you were doing internal mouth work, is that correct?
I was not, although certainly with craniosacral you can, as you well know, do work inside the mouth. But she turned her head and chomped on, I think it was on my shoulder. But once the storm had passed and she had released what was stuck inside of her and the emotions and the experience of trauma that had been residing within her, once she was able to clear that out, she was an entirely different child. She was calm. She smiled. When I spoke with her guardian after the session a few days later, the guardian was completely blown away at the change in her and how she was able to tolerate, getting her pajamas on at bed. That used to be a real struggle, became a much calmer, simpler, easier process for both of them. And she felt that her level of discomfort had really been decreased based on she didn't cry as much. She, again, as I said, tolerated different routines much more easily than she had in the past. So that was a really meaningful experience for me and really gratifying to be able to provide relief for someone who had really been through a terrible tragedy.
So basically, craniosacral therapy is good for all ages, not only adults, but children as well.
Exactly, yeah. And children and infants are some of my favorites to work with. I think because work at that age is so foundational and can really change their body's ability to function at such a young age, whereas adults, by the time we get to adulthood, we've accumulated a fair amount of adventures that have left their mark on our tissues, on our bodies, on our psyches even. And it can be a more complex process as an adult, still incredibly rewarding and satisfying. I just love being able to help an infant get started on the right foot in their life. So if they've had some birth adventures, that have been less than ideal, craniosacral can be really valuable for resolving the impact of that and helping them move forward that much more easily and that much more balanced.
Awesome. Now, my show is about being in total connection with herself. What can you tell women about the benefits of craniosacral therapy and then connecting, making that connection with their self?
Yeah, great question. It's one of the things that so attracted me to pursue training and to specialize in craniosacral was the emphasis on helping people connect more with their bodies. And I think especially as women, we give and give and give and give, and we are caring for so many people in our circle of influence, and it's incredibly easy to neglect caring for ourselves and to disconnect from ourselves in the process. And to be able to set aside time for ourselves and set aside time that has a specific focus on enhancing connection and building a bridge between your mind and your body so that that communication is able to happen that much more clearly, that much more effectively. And when we as women are present and grounded in our bodies, we are able to show up in the world so much more effectively and impactfully. And when we have a full tank that we are operating from, we can be so much more present and so much better resourced to be able to cope with the things that life throws at us. And I'm really incredibly passionate about helping women take care of themselves, helping women value themselves, because I think that we model that for the rest of the world, and that is sorely needed in these times.
Oh, Lisa, you just gave me goosebumps. I think you read my book. It is all about taking care of ourselves first, because the analogy I like to use is when you're on a plane, the flight attendant will say, if the airbags come down, put yours on first, and then help the loved one next to you. And really, as women, we have to take care of ourselves. We have to. It's a must, not a need. And I think it's just brilliant what you just said. And I wanted to mention to the listeners, I know there's people from all over the world listening to this. If you want to look for a practitioner in your area, go to www.upledger.com. That's upledger.com. And then click on Find a Practitioner. There are craniosacral therapists all over the world that do this. And this is such a powerful type of therapy. So, Lisa, I'm going to put you on the spot.
Yes.
Do you get your own craniosacral therapy? Do you go see a therapist?
I do.
Awesome.
I think that is really so critical for those of us who are therapists to receive the work, because doing your own work on the table helps, or doing my own work on the table helps me be that much more present, and it helps me relate and have a frame of reference for my client's own experience. So I can really, when someone is perhaps feeling uncomfortable or uncertain, I can really relate my own experience of that, and I can also relate what it's like to come through that and to feel the power of the work and to know that in my own self. I think that's really, really important for those of us that practice to be able to authentically speak to the experience of receiving craniosacral.
Well said. And Lisa, for those of you that are massage therapists or looking and curious about craniosacral therapy and perhaps becoming a therapist, Lisa does mentoring. Lisa, we have about a minute, so you want to talk about your mentoring site?
Yeah, absolutely. I have a website called anatomyconversations.com, and it is all about supporting craniosacral therapists in deepening their skills and enhancing their confidence so that they can be that much more effective at growing their business and getting really good results at the table with their clients. And it's also a resource for people who are curious about craniosacral and want to get a sense of more and what it is about. I welcome anyone interested to come visit, and again, it's anatomyconversations.com.
Thank you so much, Lisa, for helping me clarify what craniosacral therapy is and what it isn't. And thank you, listeners, for listening in on my show, Being in Total Connection with Yourself. And this is a wonderful tool to help you make that inner connection. Thank you for listening to the